Hello nurses, I am back with another procedure and skills nursing lecture. For today, we are going to discuss about blood transfusion therapy. If you want to know more about that, stay tuned. Welcome back to my channel. If you're new here, my name is Neil Galve and I'm a registered nurse and I do have a degree in medical surgical nursing. I create my nursing educational contents to help nursing students and nursing professionals with their studies. If that's something that you are interested in, consider subscribing. If you are already a subscriber there, thank you so much for your love and support. I see you. I upload my nursing educational contents 2 to 3 times in a week. Don't miss that out. Subscribe now. Hit the notification bell so that you will be the very first to watch my newest uploads. Also, don't forget to give this video a big thumbs up and share with your friends because that will really help me know that you like to see more contents like this. Without further ado, let's jump into the video, nurses. Hi everybody! Yes, for today, another nursing procedures and skills video ang alay ko sa inyo because we are going to have blood transfusion therapy. Yes, ibibigay ko sa inyo lahat ng kailangan nyong malaman when it comes sa pag-administer or pag-start ng BT before, after, and during. Exciting, di ba? And I am so thrilled to share this video with you guys. I know that BT therapy is really common na makikita mo sa ward o makikita mo after ng surgery or sa mga trauma patients. And this is really going to help you out in remembering those concepts. Now, in order for me to do that, I will need to switch back to my PC and I'll see you guys in a bit. Alright, hi everyone! Welcome sa ating formal discussion ng yung blood transfusion therapy. Yes, ito po ay under ng nursing procedures and skills and let this be your nursing study guide sa pag-aaral mo ng yung BT. Now, let's start our discussion with our objectives. So, we're gonna have overview, advantages, blood components, objectives, nursing intervention, nursing implementation, and nursing evaluation. Now, isa nga ito sa mga playlist ko dito sa aking channel under ng nursing educational contents where I create nursing related discussions, topics, videos, nursing reviewers para sa inyong lahat. Hindi lang to para sa mga estudyante, pati na rin to sa mga professionals na, sa mga rehistrado na, para maging constant reminder about sa mga nursing skills and procedures that we have. I know that it could be overwhelming. Alam ko na minsan kapag hindi na pa-practice, nakakalimutan yung concept. So might as well, before proceeding to your BT therapy with a patient, you might want to brush up with this discussion, with this video, with me. I-refresh kita, wag ka mag-alala. I got you, baby, okay? Now, if you haven't watched the other playlist I have or yung nursing procedure skills playlist where I created tons of videos, marami doon. Meron na ako sa NGT, meron na rin ako sa tracheostomy care. You might want to check that out sa description box or just simply click the icon button pag may nag-pop out dyan, sa icon button. I-click mo lang yon kasi nandun sila lahat, okay? Alright, so let's begin. Overview na po tayo ng ating BT. So blood transfusion therapy or BT involves transfusing whole blood or blood components specific portion or fraction of blood lacking in patient. So nurses, you need to learn the concept behind blood transfusion therapy and the nursing management and interventions before, during, and after the therapy. Importante yon. Huwag ka mag-alala because we're gonna cover that here. Alright, so ano ang advantages ng yung BT? Alright, so first, it avoids the risk of sensitizing the patients to other blood components. Next, it provides optimal therapeutic benefit while reducing risk of volume overload. It increases availability of needed blood products to larger population. So those are your advantages, ha? Now, proceed na tayo sa ating blood components. Alright. Ano-ano nga ba na kung medyo marami ito yung mga binibigay natin? Pag sinabi kasi nating blood components, diba, this is very specific kung ano yung kailangan ng pasyente mo. Mamaya, ibibigay ko sa iyo ng thorough yan. Ito na siya. Alright, so isa-isahin natin sila. Here's the table for you. You might want to do a screenshot of this, just for your constant reminder. Let's do this one by one. So pack RBC, PRBCs, ano ito? It has 100% of erythrocyte, 100% of leukocytes, and 20% of plasma originally present in 1 unit of whole blood. Leukocyte poor packed RBCs, ano naman ito? Indicated for patients who have experienced previous febrile, no hemolytic reactions. Platelets, familiar ka niyan, clotting factor natin. natin, either HLA or human leukocyte antigen match or unmatched. Granulocytes, it contains basophils, eosinophils, at neutrophils. Ano tong mga to? Mga components ng iyong WBC. Alright? Now, fresh frozen plasma. It contains all coagulation factors, including factors 5 and factors 8. Single donor plasma contains all stable coagulation factors that reduce levels of factors 5 and levels of factors 8. The preferred product for reversal of comadine-induced anticoagulation. Next, we have your albumin, a plasma protein. Cryoprecipitate. This is a plasma derivative rich in factor 8, fibrinogen, factor 13, and fibronectin. Factor 9 concentrate. A concentrated form of factor 9 prepared by pooling, fractionating, and freeze-drying large volumes of plasma. Factor 8 concentrate. Ano naman ang laman nito? A concentrated form of factor 9 prepared by pulling, fractioning, and freezing drying large volumes of plasma. Lastly, you have your prothrombin complex. Now, this contains prothrombin and factors 7, 9, and 10, and some factors 11. Malinaw sa iyo yun? Proceed na tayo. Baby, on this slide, we're gonna have the objectives. So, ano-ano ba yung mga objectives natin? Bakit natin ito sinasagawa? Well, 1, to increase circulating blood volume after surgery, trauma, or hemorrhage. Sa surgery, yes, may kailangan meron kang naka-request o nakaantabay na blood dyan just in case na magkaroon ng hemorrhage during the surgery, which is one of the complications of surgery. Okay? So, nandyan siya. Trauma, may blood loss dyan. Hindi natin alam kung anong klaseng injury ito, but binibigay rin siya sa mga trauma patients, for internal or external bleeding. Papasok na rin dyan yung concept ng iyong hemorrhage, pagdudugo. Ano pa? To increase the number of RBCs and to maintain hemoglobin levels in clients with severe anemia. Yes, patients who have severe anemia, normally binibigyan sila ng blood components, mga pack RBC, or depende sa order ng doktor. This is really to refresh the level of hemoglobin in the patient's body. Ano bang meron sa hemoglobin natin? Di ba nandito yung iron, nandito yung oxygen. Okay? Next, you have to provide selected cellular components as replacement therapy. Example nito, clotting factors, platelets, and albumin. Next ka na. Dito na tayo sa ating nursing intervention. I know that you guys are waiting for this. Alright, so we're gonna do this one quick. Here's a table for you. Nursing interventions mo include the following. Nurses, you need to verify the doctor's order. That is very important. Yan ang una mong gagawin. I-verify mo kung ang pasyente mo ba is for BT talaga. Inform the client and explain the purpose of the procedure. It is very important for you to explain why this BT is needed for the patient's condition, whatever condition that is. Kasi para, to gain trust and para iwas na rin tayo ng mga disputes or for legality. And that's also one of your patient's right to know every procedure, any procedure, any medical intervention, treatment, medication that is being given to them. Okay? Next, check for cross-matching and typing. This is to ensure compatibility. Number 3, obtain and record baseline vital signs. Why is this very important, nurses? Because this will serve as your baseline data. Importante yun kasi malalaman mo kung nagde-deteriorate. Nilalagnat ba ang pasyente mo? Pre-BT, wala siyang lagnat. Nakita mong tumaas. Dahil ang baseline data mo, ang temperature ng pasyente mo, let's say 36.4. During the BT therapy, blood transfusion therapy, nakita mo naging 37.8, naging 38 or 39. That's your febrile reaction. So, importante na meron kang baseline data para malaman mo RR, blood pressure, pulse rate, all of that good stuff. O2-SAT, isa yan sa mga dapat mong kunin. Now, next, you have practice strict asepsis. Yes, aseptic technique nga po ang kailangan nating i-practice to prevent spread of infection. Kasama dyan yung paggagamit ng PPEs and all of that good stuff, pagtatapon ng mga medical waste sa tamang lagyanan, yung mga needles and syringes, yung mga tubings, alam mo dapat sila kung saan sila ilalagay, okay? Doon sa infectious waste or receptacle. Next, at least 2 licensed nurse check the label of the blood transfusion. Mind you guys, nakita mo to,
at least 2 licensed nurse, meaning mga RN, hindi pwede ang PDN. Licensed RN, dapat nag-ano sila, ang tawag doon, nagko-cross match. Yung tinatawag na natin ganon, ha? Ano yung mga i-check ng ating mga nurses o 2 nurses na yan? Una, yung serial number, blood components, blood type, RH factor, expiration date, screening test, yung VDRL, HB-SAG for hepatitis, and malaria smear. This is very important, you guys. Crucial to. Normally, ang ginagawa sa area, yung unang nurse, si nurse 1, ang babasahin niya lahat ng to. Huwag ka mag-alala kasi itong mga information na to, nandun yan sa tag, dun yan sa bag. Makikita mo yan doon. So, tapos meron kang list na ibibigay mo doon sa nurse number 2. I-verify mo yon. Sasabihin mo kung ano yung nakikita mong serial number doon sa bag without looking doon sa list na nakuha mo doon sa order form. Pagkatapos noon, pwede nyong gawin, o ikaw naman, mag-change kayo. Ikaw naman mag-check dito. Ako naman yung hahawak ng list. This is really for us to make sure that we are giving the right blood components sa ating pasyente. Kasi pag maling blood components na bigay mo sa pasyente mo, ay, sinasabi ko sa iyo, ayaw mo noon magkakaroon ng maraming komplikasyon. Okay? Number 6 na tayo. Next na tayo, ha? Warm blood at room temperature before transfusion to prevent chills. Anong pwede mong gamitin sa pagwawarm ng blood? Well, you can use cloth. Okay? Kasi 'di ba ang blood kapag galing yan sa blood bank, normally medyo malamig yan, chilled. Okay, para ma-prevent yung hemolysis or something like that. What you're gonna do is you can wrap it up with a cloth. Next, number 7, identify client properly. 2 nurses check the client's identification. That is very, very important, you guys. Next, use needle gauge 18 to 19 to allow easy flow of blood. Okay? Now, use BT set with special micron mesh filter to prevent administration of blood clots and particles. Normally, kapag nagbi-BT tayo, meron tayong specific na ginagamit na BT set. Meron na yung nakalagay na mesh. Oo, kasi parang finifilter niya yung mga bigger blood components natin, mga blood clots na makikita mismo doon sa bag. Okay? Kasi may iba doon, may iba sa mga blood na yon ay what you call this, nagka-clot na. Ayaw mo naman mag-introduce ng blood clot sa pasyente mo kasi pwede mag-travel yon sa other parts of the body, baka mapunta pa sa heart, mahirap na. Ayaw mo rin mapunta yun sa baga kasi pwedeng maging pulmonary embolism. So, make sure na ang gagamitin mo ay yung mesh, micron mesh filter para ma-filter yung mga blood clots and other particles ng iyong blood. Okay? Now, start infusion slowly at 10 GTTS or microset per minute. Remain at bedside for 15 to 30 minutes. Well, adverse reaction usually occurs during the first 15 to 20 minutes. So, close monitoring po tayo for the first 15 to 30 minutes. Okay? So, i-regulate mo yung drop factor mo. I-regulate mo yung BT mo na 10 microdrops per minute. Okay? Now, monitor vital signs, altered vital signs Next, monitor vital signs. Now, nurses, you need to understand that altered vital signs indicate adverse reaction. Ano-ano to? Increase in temperature, increase in respiratory rate. Yun yung mga babantayan mo. And you also wanna instruct your patient if he or she is having any plank pain or any pain in his abdomen or his or her abdomen, yung back pain. Kasi pwedeng mag-signify yun na nagkakaroon ng interaction or nagkakaroon ng adverse effects sa kidney. So yung mga ganon, yung mga simpleng ganon, pwede mong i-instruct yun sa pasyente at pwede mong obserbahan yun sa pasyente. Once you notice anything about that, once you notice any adverse reactions, you might want to stop the BT right away and call your physician. Alright? Now, do not mix medications with blood transfusion to prevent adverse effects. Do not incorporate medication into the blood transfusion. Do not use blood transfusion lines for IV push of medication. Why? Kasi, you need to give medication during BT. What you're gonna do is to use a different line because you really want to prevent adverse reactions from happening. Okay? So use a different line. Ano pa? Administer 0.9 normal saline before, during, or after BT. Never administer IV fluids with dextrose because nurses, dextrose-based IV fluids causes hemolysis, breakdown ng iyong blood component. You don't want that, okay? So ano ba yung perfect na match natin? Nakikita mo to sa area. Reviewin natin. Ang pinaka-perfect match pag nagbi-BT ka, perfect match ng IV fluids, is 0.9 NSS. Next, administer BT for 4 hours. Ano yung mga 4 hours na binibigay? Yung whole blood, packed RBCs. For plasma, platelets, and cryoprecipitate, transfuse quickly 20 minutes. Clotting factor can easily be destroyed. So 20 minutes, yung may mga clotting factors natin. Ano yon? Yung platelets, plasma, and cryoprecipitate. Lastly, observe for potential complications. And then once you have those complications, notify the physician. Na huwag ka mag-alala kasi bala ko gumawa ng videos about sa blood transfusion reactions. Abangan mo yon. Maraming klase na mga adverse reaction during BT. So gagawa ako nun para maging reviewer mo rin, okay? Nursing implementation. Alright, so ano yung mga implement mo? If blood transfusion reaction occurs, stop the transfusion, period. Start IV line, 0.9 normal saline. Place the client in Fowler's position if with shortness of breath and administer O2 therapy. The nurse remains with the client observing signs and symptoms and monitoring vital signs as often as every 5 minutes. Notify the physician immediately for any adverse reactions. The nurse prepares to administer emergency drugs such as antihistamines, vasopressor, fluids, and steroids as per physician's order or protocol. Obtain a urine specimen and send to the laboratory to determine presence of hemoglobin as a result of RBC hemolysis. Blood container, tubing, attached label, and transfusion record are saved and returned to the laboratory for analysis. Once again, these are your nursing interventions. Alright, nursing evaluation naman. Ano-ano yung mga i-evaluate mo as a nurse? Ito na po siya. The patient maintains normal breathing pattern. The patient demonstrates adequate cardiac output. The patient reports minimal or no discomfort. The patient maintains good fluid balance. The patient remains normothermic, meaning normal body temperature. The patient remains free of infection. The patient maintains good skin integrity with no lesions or pruritus. The patient maintains or returns to normal electrolyte and blood chemistry values. Once again, nurses, these are your nursing evaluation. Alright? Maraming salamat po sa lahat ng suporta na binibigay nyo sa akin. You guys, thank you so much for watching. Please like, share, and subscribe to my channel for more nursing educational videos. Let me know if you have other nursing topics that you want me to do for you. Comment down below. Abangan nyo po yung mga next video natin for this week. Napakarami ko pong ginawa para sa inyo. Alam ko na marerefresh kayo at marami kayo matututunan. Guys, maraming salamat po for making this happen. We've been really growing and I wanna send my love to all of you guys. Maraming salamat po. Ipamalita mo na nga sa lahat. Ang pinakabago at pinaka-fresh na nursing review center, free nursing review center sa balat ng YouTube. I'll see you again next time. You stay safe, nurses.
Thank you so much, you guys, for watching. Hope you learned something. Help me grow my channel. You're already here. You might as well subscribe. #TeamCoolTalk. Give this video a big thumbs up and share with your friends. Let me know what you guys think. You put them down in the comment section below. Also, don't forget to check out other playlists I created for you. I'll be putting the links on the description box, or simply click this icon button right here. Let's connect. Follow me on all my other social media accounts. Everything is at Neil Galve. I'll see you again, baby.